Hey, it's Dr. Amit from Ofek Chiropractic. One of the biggest questions that I get all the time from parents is, what are you seeing kids for? I mean, how can you help my child? He doesn't have a bad back or neck issues. They may have digestion issues, or they may have sensory processing issues, or autism spectrum. They may have all these things that really has nothing to do with what most people think about chiropractic. But here's the thing, a lot of questions I get is really about this testimonial here behind me, which is a great representative to what I'm doing in my office. And this specific one is about a young child, a girl that really had all kind of health issues since she was born, starting at birth. And anywhere from severe digestion issues and constipation, sleeping issues, colic, reflux, ear infections that kept on coming back. And we couldn't even count really the amount of rounds of antibiotics she's gotten through life. And that just continued, these health issues throughout life. And eventually they got a diagnosis of autism spectrum and sensory processing issues, and retained primitive reflexes and ADHD and all these things. They started doing occupational therapy and all kind of other therapies and supplements. And these things helped somewhat, but the parents didn't quite see the results they wanted to see. They knew there's more. They knew their daughter can express a lot more health, and a friend recommended chiropractic care, looking for a chiropractor that can see kids. And they came here around age of 8. She was 8 years old. And very early on in her care, they started seeing really great positive changes in her sensory integration, in her behavior. Wetting her bed was a daily routine. That has started to decrease, which is an incredible thing all by itself. And their occupational therapist asked them, like, what are you guys doing different? I noticed different things on her, in her overall behavior and even her musculature and all that stuff. That's so wonderful to see these changes that are possible, okay? And one of the tools that I use to explain parents what is it we do is what we call a baseline assessment, okay? And that's this questionnaire that I offer to all parents, to all kids under the age of 15 at my expense. It's a questionnaire that we can pinpoint and say, hey, there's something that we can look into, and we're better off exploring more, okay? And what I explain parents that is these circles represent traumas to the nerve system, okay? Our brain, our spinal cord, delicate nerves that go throughout the body. And every time there is a circle, a trauma, that decreases our ability, our child ability to express health. They have a certain potential, so the potential is less than 100% now. This first one here represents birth, and often 80 to 90% of the time we do have what we call a traumatic birth syndrome, and that's for many different reasons, but that's the first trauma. Then we have more and more traumas that can be from physical, emotional, chemical traumas, but these traumas they accumulate, and they accumulate up to a point where the body says, I can't deal with this anymore, and now we're seeing issues. That can be issues, pain, that can be issues, colic, reflux, multiple ear infections, processing issues, autism. All these things has to do with how much trauma the nerve system has accumulated. Now, what I do in the office or with chiropractic is help remove these layers, and help build this health again, okay? And it's incredible to see. So if you're a parent that have questions regarding your child's health, whatever the concern is, my recommendation is call my office, schedule a baseline assessment face-to-face, or we can actually schedule one over the phone where I'll email you one of these and you can complete them and we can discuss it over the phone. But again, you have nothing to lose and everything to gain by doing a baseline assessment. So thank you so much for watching, and we'll talk soon. Bye.